Stroke presents with sudden onset of loss of function. Any function that's suddenly lost is a stroke until proven otherwise. It may be vision in one or both eyes. It may be a reduction in the ability to communicate effectively. It may be weakness, numbness, or clumsiness on one side of the body. And it may be a sudden, severe, unexpected headache. Any of those symptoms represents a neurological emergency, and you need to dial 911 immediately. Dialing 911 is your best chance of being taken to a stroke center where you can be rapidly evaluated and treated for time-sensitive treatments. By time-sensitive, I mean that the earlier you get treatment, the better. Every single minute matters during a stroke. The effectiveness of the treatment is greatest in the first hour after onset of symptoms, and after several hours, it doesn't work anymore. So every minute matters. You need to act fast if you recognize symptoms and signs of stroke. The F stands for face, the A stands for arm, the S stands for speech, and T is to remind you that time is of the essence, that every minute matters. You can assess someone's likelihood of having a stroke by asking them to smile. If one side of the face doesn't move as well as the other, this may be a sign of stroke. You can ask someone who you think has had a sudden change to hold their arms out in front of them. If one arm drops or drifts down before the other, that is a sign of stroke. You can ask someone to repeat something simple back to you, like, "Today is a sunny day." And if their speech comes out slurred or they have trouble expressing that sentence, that's a sign of stroke. And then think time. Every minute matters. Call 911 immediately. Face, arm, and speech are affected in about 90% of strokes. Touro Infirmary was certified by the Joint Commission in 2015 as a primary stroke center. This means that Touro Infirmary's administration has a commitment to providing excellence in stroke care such that stroke can be evaluated and managed efficiently and appropriately and give every person having a stroke the best chance of an independent outcome. The foundation of stroke care is in administration of a thrombolytic, which we refer to as TPA or F.A.S.T. This medication for the clotting form of stroke is highly effective at reducing the long-term disability. At Touro Infirmary, our stroke team responds rapidly and works efficiently to optimize the treatment time, that door-to-needle time, the time from a person arrives at our hospital to the time that they get treated with the clot buster when appropriate. Touro Infirmary is really fast at administering the clot buster for appropriate patients, and this equates to improvement in long-term outcome.